Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everyone. Thank you for joining the Dhaman's webinar, Doctor's Career Burnout, in association with Kuwait Medical Association. We would like to first start with Dr. Ahmed Al-Anizi, who is a chairman of the Kuwait Medical Association. Dr. Ahmed Al-Anizi.
So good evening, everyone, and it's my pleasure to be with you and open this very important and very interesting webinar and session that discuss one very important aspect relates to the medical and health professionals here in Kuwait. And I welcome all of you, and I would like also to thank Dhaman for their activity, for doing such an activity, which is, as I said, it's very important issue that we have to stop at, discuss, try to find the key problems and find the solutions for that. There's no doubt during Corona era, which is still going on, health professionals have faced many challenges, physical and psychological challenges, pressures, a lot of pressures. They worked under stress. There was no vacation for a long time. The risk and the fear of acquiring a contagious infection, the risk of transmitting this infection to the beloved, their relatives, their spouses, their children, also the isolation from their families because of this fear, physical pressures, the duties, and unfortunately lately we started to hear people are resigning, and the number of number of doctors resigning are increasing, or no show at work, and they disappear. They go home and they don't come back, and they don't even call back. A lot of really physical and psychological pressure the health professionals have faced during this era, during this pandemic, and it's worth really discussing, worth really stopping and finding the key problems and the key solution. So I'm very happy to be with you today, and again thank Dhaman for this activity. And my thanks to our speakers today, Dr. Adil Zayed, Dr. Mohammed Al-Ubaidan, and the CEO of Dhaman, Dr. Mohammed Al-Qana'i, again for this session. And I hope that we all learn and try to find some solutions to reduce the pressure and to help the health professionals to maintain their work and support the health system here in Kuwait. Thank you very much.
Thank you, Dr. Ahmed, for this lovely speech. It is very inspiring, and I think a lot of people needed to hear this, especially from you. Dr. Ahmed, before we move on to Dr. Mohammed's presentation, maybe we can have a question for you about the role of KMA during the pandemic. For the doctors, what is the biggest role you had?
Okay, so we, thank you, Noor, for this question. We, as the KMA, we represent the doctors, the health professionals in general, not only the doctors. And we do see directly and communicate directly with all health professionals in field, face to face, and try to find any challenges, any problems, and try to solve these challenges with the Ministry of Health. Yes, we had a lot of roles during the pandemic. The initial stage of the pandemic, the KMA have opened the voluntary or organized the voluntary work from the doctors to the health system. We created an important bridge between the society associations and charity associations here in Kuwait and the Ministry of Health to help support all the activities and all the demands that the Ministry of Health have faced at the beginning. Now, when it comes to the doctors, during the pandemic, we had several, maybe almost once a week or even more sometimes, meetings with the decision makers in the Ministry of Health, the Minister and his colleagues in the Ministry of Health, to discuss challenges that health professionals and doctors are facing. And one of the activities that we did during the time when we felt that there was some deficiency in the PPE and the personal protective equipments, the KMA have tried its best to communicate with the local companies, the manufacturers here in Kuwait, to provide the PPEs as much as we could have and distribute it among the doctors who did not have any, or they need extra stuff. Of course, we had communicated with other ministries like the Ministry of Social Affairs to help them in going to supermarkets without any permits. Just being a doctor, you can go and just anytime. If you remember, during the pandemic, there was some times that you're not allowed to go to the supermarket if you don't have a permit, special permit, but for the doctors, it was open all the time. The financial support, the vacations, we tried our best to, when the time allowed us to have some vacations, we really pushed and squeezed our colleagues in the Ministry of Health to open up vacations to relieve the stress on the doctors. Also, financial support regarding the extra hours work, and some of them who worked very hard had this. And probably you heard today, the Civil Commission have released the lists for the mukafa'a, for the reward of Corona. Also, webinars and online sessions to discuss certain points of the pandemics that related to the doctor work and related to the pandemic itself. Also, communication with the society to support doctors. Lately, we have heard a lot of some attacks, some comments, bad comments against the doctors. The traditional medicine advocates against the modern medicine, and they try, some of them, very, very few people, but their sound was very loud, attacking doctors, attacking their role, creating doubts in their work and their humanitarian efforts that they were doing. And we have faced that by trying to work with the media, highlighting the role of doctors, and also indicating the law. What are the law? What are the rules and punishments if you attack doctors in a bad way, whether during their work or, for example, in the social media. So these very few points that I can recall now, but KMA is the house of the doctors and all health professionals. So we open our doors to listen to any problems, any challenges that the doctors are facing, and we try to solve them together during or through the communication with different organizations, and on top of them, the Ministry of Health.
Thank you, Doctor. Really, I think the role of KMA was very important, especially supporting doctors. Thank you so much for being here. Please stay till the end for our discussion, Dr. Ahmed. And now we will move on to Dr. Mohammed Al-Abaidan. He will give us a talk about the laws, and especially with the new law that was in 2020. And he will highlight probably the relation between the burnout and what protects doctors from burnout from a legal point of view. Welcome, Dr. Mohammed.
Thank you, Dr. Noor. I'd like to welcome everyone and hope you have a good evening. First of all, I would like to thank Dhaman for this very important initiative. Of course, burnout is very important during these days, especially in the pandemic areas. I've been through the literature. I was shocked about these high percentages. I would never even imagine that it would reach to this one. So I thank you once again for this very important webinar, and I hope everyone will benefit from it. So before I go to my speech, I'd just like to highlight what I'm going to talk about. As you just said, I'll talk about the laws and how are they protecting the doctors. Of course, we are willing to get more benefits, but that's the thing that we have here. I'm going to highlight them. Before I go through to that, I'll talk about the statistical fact about this burnout, and I'm sure that even the audience is going to be shocked about these high numbers. Also, I'm going to talk about what did we do as KMA in these times, the pandemic time. So let's start the presentation. So let's start with the statistical fact about this problem. To start with, as we all have seen and noticed in the pandemic time, the burnout has become more apparent, especially in the first start thing of the pandemic. So it has risen to staggering levels since the start of this pandemic. More than 50% of younger doctors in the UK considering leaving for a different career, which may reflect that's how serious it is. Overall levels of burnout increase from 68% by 68% from a previous survey done by NHS in the UK and the PubMed. It was before 22 to 37%. Now I think it's doubled or even tripled. These numbers have been classified according to the generation. I'll just move to the second slide to just give you an idea about the generation I'm going to talk about. So as you can follow the pointer, the baby boomers are going to talk about them. These are the generation that were born from 46 to 64, Generation X, 65 to 80, millennials, 81 to 96. Why am I mentioning this? Because it was classified that Generation X, the one I just mentioned, was more burnout, 42%, due to several factors. Millennials come in second place, 41%, and baby boomers, 30%. So, and more than 25% of doctors said that burnout has a severe impact on their life. Definitely, this is true. The burnout does not only reflect on the daily activity, it reflects on your social life, it reflects on your interaction between the patients, and how are you going to talk to them, how you are going to plan their treatment. It affects mainly in all several aspects of your life, and we are going to see that how just a bit. 66% describe themselves as feeling sad or blue. 32% of the millennial doctors have clinical depression. Shockingly, 57% of male and 39% of female considering changing their job. So when considering asking action to reduce burnout, they say even they are young in age, they say that early retirement is like it was most common answer to question between them. So this is how serious this problem is. Among younger doctors, 53% they were considering leaving the medicine for a different career, and 40% say that they would look for a different job in medicine. This is very important, and even the numbers are very high. Even though this is a study was done in the UK in November 2020, like in the mid-time of the pandemic, and this reflects how serious the problem is. If they say 50% of these leaving their jobs, what is the action, or what's gonna be like to serve patients if they just left the medicine field? And this is shocking. 49% of physicians in all generations would accept less money for more free time. This is a study was conducted in January 2020. Shows that money is nowadays not important. They just want to have a more free time. So I'm going to move after I have explained these statistical facts. So why do we need to prevent it? Why it is so important to look at this problem, to solve this problem, and if we leave it as it is, what's going to happen? So two parties have taken place in explaining the problem. The professional point of view, the medical field, I mean, and the state point of view. Yeah, it is important on the state, I mean, the country that you are working in. Burnout has cost a lot of billions in the incomes for a lot of countries, and I'm going to explain this in a bit. So why do we need to prevent it? Medical errors can happen, poor medical services, poor doctor-patient satisfaction, poor relationships with, at both, not at your work only, even at your home, with your children, with your wife, with your relatives. You cannot control that if you have burnout. See the shocking number, and the study was done in the US. It was done in June 2019, before the start of the pandemic. It costs about $4.6 billion annually, the burnout itself. And this was before the pandemic. What's going to happen now? I think it was doubled and even trebled the number. So just to explain more about this problem, I have found a study that was done in July 2006. It mainly talked about what are the consequences of the burnout in three aspects: the patient care and the health care cost and the physician health. So in the professional point of view and the state point of view. So let's talk about the patient care. So professional consequences, as I have mentioned before, can contribute to the failure of interpersonal relationships. It can increase medical errors. It can increase cases of malpractice. Let's go to health and its costs. Physician burnout might result in ultimately departure of physician from their job, which could cause a paralysis in the medical services, which will reflect on the society health. So it's like a chain problem. If you did not treat it from its head, the root of this problem will reach all over to the whole society. And also physician health. Let's say they don't want to work, and if we keep them without treatment, their health is at danger. So it's by effect, it can be the physician himself can be feeling tired, exhausted, fatigued, inattentive, irritable. Burnout can also put physician at increased risk of motor vehicle accidents, near-miss event after adjusting for fatigue. Psychologically, which of course my mentor, Dr. Adil Zayed, will talk about more thoroughly. Increased odds of substance abuse. And I have seen a study that talked about this. There were 20% increase in substance abuse between physicians in the USA due to burnout. So let's talk about the law, the one that we are having here. So we have two laws talking about the relationship of doctors and their beneficial or financial beneficials. Are they with the doctors or against them? Of course, it's not the way that we hope for, but it's fairly fine for the doctor. So I'm going to explain how. So this is the law number 5/2010, talking about the payment and the classifications for the medical professions. I went through this law and have found some benefits, like the financial benefits, the annual raise to the basic salary as an encouragement to the physicians, and training award, which we will be giving monthly for physicians who trained other physicians, and this would start from the senior registrar level and above. There are a lot of financial benefits. I didn't go through them, like whenever you get say educational degree, you get more payment. Whenever you get by the years that coming, gonna get higher on the basic salary. So there is a lot of financial benefit, but I focus about these two benefits due to the topic I'm talking about. Leaves also, as we have mentioned before in the studies, a lot of doctors want a free time. So this law talks about the leaves. You have 60 days of annual for those who complete annual leave days. For those who completed 15 years or more, 45 days of annual for those who are less, and 15 days paid sick leaves. So let's move on to the new law that was agreed on by the Parliament in last October 2020. It's called the Practice of Medical and Paramedical Professions, the Rights of Patients and Health Facilities. It's fairly a huge articles. It has more than 80 articles talking about the issues for the medical professions and how to protect them, and of course talking about the medical facilities. I have picked some of the chapters and the articles. Say here, medical liability, article number 34. It said the physician shall not be held accountable for the outcome of the patient condition as long as he has exercised due diligence that has restored to all the available means that can and ought to be used by anyone in his circumstances with his specialty and his academic practice and professional degree. Why am I mentioning this? Basically, I'm saying that there are no pressures anymore, not like before. There are no pressures on the physician if he did the best, and medical errors can happen. After all, we're all human. We're not machines. So if it happened, you are going to be fully protected from the administration you are working in, whether you are working in the ministry or other facilities. So what does that reflect? It will reflect like some ease and some peace with yourself. You don't have to be stressed all out through the day. You are going to get accounted for whatever mistakes you are going to do, and hopefully nothing will happen. But if it did happen, and it can be happen, you are fully protected. Article number 33. The ministry and other government entities, that provide healthcare services shall execute the final judgment issues against their medical professions for any personal or administrative error through the settlement from the special budget of the entity to which the medical professional belongs. Again, yes, you are protected, and if something happened and it was said that yes, you did a mistake, still you are protected. Even the penalty that may get you from the court, it will be covered 100% through the administration you are working in. So this will give you some peace of mind. You can work in a safe environment. You can even try something new, not like before. We have some like restraints or something you cannot do because you are afraid of the penalties. Now you are fully protected against them. So what about like someone hits you physically or someone say bad things about you? How are you protected? So I've mentioned the two articles, article number 71, without prejudice or to any severe penalty prescribed by another law, shall be punished by imprisonment for a period not exceeding 5 years, or a fine not more than $10,000, or by either of these penalties whoever commits physical aggression against the medical profession in the course of the performance of his work or by reason thereof. So still you will get your rights with this law. I think the number of aggression against doctor shall be much less, and you will feel much better that you are protected. And even someone said bad words to you, not only physically, even verbally. The law says here in Article 72 that a period not exceeding 3 years of, and a fine not more than 3,000 Kuwaiti dinars, or by either of these penalties, whoever crosses, defames, insults, or defends the medical profession. These two articles are specially for doctors, and it's not given for any other civil employees in the country. So what I'm imposing is you are protected even if you did a medical error. You are protected even if someone insults you, whatever, physically or verbally. So which will give you like a better environment and a safe environment, and hopefully will get your burnout much less. So about these laws that I have just mentioned, are they perfect? Definitely not. We need more benefit and privileges. So as KMA role, we have contributed mainly in the last law number 70/2020 that I have just mentioned. Thankfully, we have had these rights, of course, and I can say it can provide a good protection for the medical fields in terms of a safe environment, in terms of less stress in work. So why do I have to mention these? And not only the articles I have mentioned. There is more than 80 articles that a doctor should know about, because it's crucial to know your right, to act accordingly. KMAs are providing booklets about the law and the doctor rights. Each year we have newcomers, we provide to them these booklets, and we do seminars about the laws and about the regulations and what with you and what against you and how to protect yourself. Moreover, we are working with other state ministries to provide more benefits and privileges for the doctors, and also we are providing a full coverage of lawyers and law affairs questions, helps if you need to all doctors in Kuwait. So what have we done to or what is the KMA role in supporting doctors suffering from burnout? So we have done many seminars. One of them is with Dr. Noor Nebari, how to cope and how to deal with it. We accept reports, burnout, and regulate meeting with MOH. So we accept your report, we get out the things that has to be done, and we get a meeting with the ministry and with other leadership in the ministry just to find solutions about this important aspect. We accept also reports about legal problem, and as I have mentioned, we provide a complete legal and lawyer support. We do social events throughout the year. We do doctor group trips outside the country. Of course, social life is very important, and it helps crucially in lessening the burnout throughout the medical field. We work and contribute with the state ministry to formulate laws and regulations to give us more privileges and benefits. As you have seen just a bit while ago, we have did some changes and corrections about the on-call regulation in the law, in which it should not be cut off from the salary, and we are getting finalizing. Thank God, the KMA and the ministry have found like a solution to that. It will not be cut anymore, and we will announce that soon. And thank you so much for your attention.
Thank you, Dr. Mohammed, for this lovely presentation. I think it is very insightful, especially about the laws and the role of KMA in managing burnout in doctors. So I hope that you can stay with us, Dr. Mohammed, until the discussion part. Now we will move on to Dr. Adil. And Dr. Adil is a psychiatrist, and he is, of course, he is well known in Kuwait for his work in the psychiatric hospital and a lot of social events. I think Dr. Adil will give us some insight about how to prevent burnout among doctors and other healthcare professionals. Welcome, Dr. Adil.
Thank you very much, Dr. Noura. Thank you very much for the organizers, Dhaman, for this interesting webinar, and thank you for the effort to put everything together to bring this kind of interesting meeting and important at the same time. Well, yeah, okay, it's not. I thought I'm still muted. The thing that.
Yeah, before you start, I just want to ask you a question. So what do you think about the data Dr. Mohammed presented to us today? Do you think it is something that is shocking, or do you think that's something it can represent the numbers in Kuwait?
Well, very much so, yes. It's very representative to the situation in Kuwait. It's not only representative for the situation in Kuwait, it's representative for the situation in the whole world at the moment. The World Health Organization expected that a tsunami of psychological impact of coronavirus on the medical professionals from the start of this pandemic, and it is clearly happening. And this tsunami is not just happening, it's still continuously happening, and we're still in the center of this tsunami. So we are still expecting even worse figures if we did not react appropriately to what's happening at the moment. And I think the situation is very critical, and we cannot wait anymore before something proactive should happen. And that's why I think this webinar is very important, because it will actually be a kind of a cornerstone or a milestone in starting or establishing a professional way of tackling this problem. The Ministry of Health have noted that, and they had a committee that is actually responsible of the psychological well-being of the corona teams, but that is not sufficient, because most of the psychiatrists and psychologists working in this committee, they have their own commitments as well in their own work. So they do not have the pleasure of time to carry on in both sides. So it might be in a way that those professionals who are expected to deliver some kind of care for their colleagues who are suffering of work burnout, related to their work, there might be actually subjects of burnout due to the amount of work they are expected to do to carry on their own work in their field, and as well look after their colleagues. So it is a very critical situation. Unfortunately, we do not have, through the committee, the psychological committee dealing with the COVID teams, we have actually statistics of how many physicians and how many professionals and all kind of medical field that have approached the committee asking for help, but we do not have generalized statistics on what's happening in Kuwait as in general, but we do see a huge, big number of professionals, medical staff, nursing staff, and paramedics who are requesting help, especially over the last 3 months. So yes, these numbers are very much representative of what is happening in Kuwait, and we hope that things will change to a better side or brighter side very soon, especially with such kind of discussions that are taking place at the moment.
Thank you, Dr. Adil, for this speech. Maybe I will have, and ask you a question about the relationship between burnout and the incidence of, the increase of depression and anxiety among healthcare professionals. I think for the time being, there is some kind of hope because of the vaccination. However, at the beginning of the pandemic, it was so scary for everybody. And some doctors were afraid to be in contact with their families. So did you encounter any doctor who reached out to you? Of course, without mentioning names and keeping confidentiality, but have anybody reached out to you for help to treat him from depression from the pandemic?
Oh, definitely. We have more than 100 cases that have approached us from medical professionals that had approached us requesting help for various reasons. Some of them, they had problems, they have a psychiatric diagnosis prior to the pandemic, and the pandemic made it worse, and they requested help. And some others, actually, due to the workload they were going through, they had some kind of psychological impact and they needed help. That happened from day one, actually, not just recently. To the contrary, actually, over the last month, we started to see some kind of reduction in number of professionals who are requesting help. This could be for many reasons, but even in the last peak of the pandemic here in Kuwait, for the first 2 months of it, I would say during June and July, actually we had a huge surge of number of professionals requesting help due to stress, anxiety, depression, especially insomnia. So we had various of symptoms and syndromes that led to people requesting to be seen. We're offering all these help through actually on call through the WhatsApp number that it has been circulated in the hospital. So the doctors were anonymous. They do not have to actually share their names or where they work or anything. We just work through their symptoms. And in some cases, we needed actually to meet with the physician or that professional person who have contacted us in person. And in these cases, most of them did not hesitate because they were actually confident that these will be confidential and so on. So they came to us and we started to work through that. So yeah, it's not just a single case or a one story that we can say. There has been many cases. And I don't think it's actually related to financial issue or vacations as it might be expected. Actually, it was more or less related to the appreciation of the community for their work. For the first month of the pandemic, there has been so much of gratefulness and appreciation for what the physicians and Ministry of Health is doing. And this has helped so much the stamina and the psychological well-being of the doctors, in spite, despite the fact that they were under enormous level of stress. But being, that they had the feel that everybody is appreciating what they are doing and everybody is grateful. So they felt that they are doing something extraordinary, and this effort is being highly appreciated by the community. So this has helped their esteem. And they continued on doing that. But unfortunately, because of the what has been circulated in the media after that for quite some time, maybe for almost a year now, the rumors about that the doctors are not doing their job, they have not been offered the appropriate medications, the policies that has been established here in Kuwait for treating corona was a big mistake, and so on. All these rumors were going on. So the what happened actually, the appreciation of the community to the work that those physicians are doing started to decline. People responded to these rumors more than more than responding to the good effort that has been put in by our colleagues. So our colleagues working in the ICU or directly with the corona, under all the pressure they are going on, either because of the long working hours or because of the risk they are working under of being infected by the coronavirus, or actually transmitting this infection to their family members and so on. Despite being under all this effort, under this pressure, they are also, in the same time, they started to sense the ungratefulness or unappreciation that has been growing up in the community, towards them. So they, at that point, they started to feel, that why I'm doing all this, why I'm going through all this, and in the same time, nobody's appreciating it. And here, actually, the imbalance, the psychological imbalance had happened. Yes, everybody was contributing this kind of unhappiness or unenjoyment of the medical professionals for what they are doing, because of the long working hours and because of that they are not taking enough vacations, or they are not allowed vacations. And because they have not been paid their benefits or so on, or whatever. But actually, it wasn't that at all. It was that they felt the unappreciation that's going in the community towards what they are doing. And this was the worst actually impact on their psychological well-being. And actually here, sorry. So here actually we should be very careful that there should be a huge role for what we should do in order to change the way this work, this magnificent work being given by our colleagues towards patients suffering of corona and working in the ICU and in the specialized wards to treat corona, how we can convey their magnificent role to the community and actually to obliterate all the rumors circulating.
Dr. Adil, I couldn't agree more. I think what doctors need is recognition, and you know, they do need the support from the community to keep going. As you know, this is a pandemic and it is not going anytime soon. Maybe the numbers come down, sometimes they come up, but it's going to stay with us until we have full control with, you know, the vaccinations, going back to school. I think a lot of things will change when we go back to normal life. Of course, Dr. Adil, you are welcome to join us in the discussion at the end of this webinar. Now I'm going to start my part of the workshop. So I'm going to start with the presentation. I am Dr. Noor Al-Nibari. I am a family doctor in Dhaman, and it is very important for us to, in Dhaman, to share all doctors and healthcare professionals our support. That's why we set up this humble workshop with our panelists, and you know, it's an interactive workshop. So please feel free to ask questions as we go along. The objectives of this workshop is to understand the definition of burnout and to understand the size of the problem, to understand the stages of burnout, recognize the risk factors, and to understand the relation between COVID-19 and burnout, and the signs and symptoms and the management of burnout. At the end, we will go to some skills for treating burnout, and I think you will enjoy this part the most. What is burnout? So maybe we can ask you guys, what do you think burnout is? Feel free to use the chat box for answers. What do you think burnout is? So burnout is an occupational phenomenon. It is not a disease. It is not a syndrome, or at least not yet. It is a work-related stress syndrome resulting from chronic exposure to job stress. Trust me, even moms can have burnout. It is characterized by emotional exhaustion, cynicism, depersonalization, and reduced professional efficacy and personal accomplishment. I think the main thing that happens with burnout is this gradual, you know, it starts somewhere, but then it gets very quickly really bad until the doctor has lost his empathy and he lost his feeling of accomplishment, which is a really terrible feeling. Is burnout a big problem? Maybe you can use the chat box to share if it's a yes or no. Do you think burnout is a big problem or not? Yes, it is a big problem. It is actually a public health issue, but we don't know how big is it in Kuwait. I think there is an underestimation of the numbers that are in the studies, because maybe not a lot of doctors want to share that they do suffer from burnout. But for your information, From the studies that's been going on, they estimated that there is 1 in 3 physicians is experience burnout at any given time. The top 3 specialities in the incidence of burnout: urology, neurology, and nephrology, according to one study. The 10th place was for critical care. Do you think the number or the specialities has changed in the incidence of burnout during COVID-19 or not? You can write in the chat box what you think. Do you think that COVID had changed things for us? I think so. I think probably now the ICU doctors are the number 1 with the emergency doctors, and let's not forget the family physicians as well. There are so many risk factors, and I don't want to go through them all, but let's say there is high demand at work, of course. When the leadership is not supportive, when there is some time pressure. And one of the studies actually showed something interesting. The more paperwork the doctor does, the more burnout he feels. Because as you know, that doctors are trained to be clinicians, they're trained to be practical, and paperwork actually increases the burnout for doctors. And it's just something that I found really interesting in one of the studies. There is also, of course, the poor organizations. And when we go to the COVID part, you will realize that there are some few things that weren't available readily for the doctors during the pandemic that made them feel more burnt out. So let's ask you a question. So how many of you did experience burnout during the pandemic? If you can just raise your hand and you can share this with me. Okay, so I think burnout, a lot of us experienced burnout, and I'm not going to lie to you. I think it's very sad that doctors often experience burnout. And I think the reason for burnout during the pandemic is the major one is the fear that we all had from the start. And then we felt a bit comfort once we had the vaccine and some ray of light was there. There is the COVID and burnout. You can see that frontliners have suffered from a lot of emotional reactions: fear, sadness, guilt, depression, and irritability. Physical symptoms such as palpitations, shortness of breath, sweating, loss of appetite, dizziness, sleep impairment. And also there was some disturbance of attention such as confusion, hyper-alertness, and some behavior change. In a lot of studies, they showed that more doctors, increased in cigarette smoking, violent behavior, heroic activities, which may lead to burnout. And although it's not necessarily a bad thing, but having this responsibility that you are a hero, I must give my 100%, is a bit tiring. Now, COVID caused a lot of problems with everybody, but why is it specific for healthcare professionals? Because at the beginning of the pandemic, there was a lack of across the world, and I'm not talking about Kuwait here, there was a lack of PPE, protective equipment, and there was a lack of mental support because everybody was, what's going on here? What is happening? I think it's the shock phase that was, until we settled, then we had some mental health support. And also the lack of training. We really didn't know what to do at the beginning with COVID until the guidelines were there. more, studies were done, then we felt a bit comfortable dealing with COVID. How to recognize burnout. Some people don't know how to recognize burnout. Maybe this slide gives you a bit of insight on that, where usually what happens is you become a cynic, and you just think that everything in your life is a problem. You will have reduced creativity and poor performance. You will always feel exhausted with headaches or stomach aches. So this slide gives you an idea of what burnout looks like. And the stages of burnout, this is the 12-stage model for burnout. I'm not going to go through that. I'll go to the less exhaustive burnout stages. So it starts with the honeymoon phase with the enthusiasm. Then you go to stagnation, then stage 3, chronic stress with frustration, then stage 4, where burnout starts with apathy, and then habitual burnout. And here you do need an intervention. I'll go to the next slide, which is the effects of burnout on healthcare workers. Dr. Mohammed did go through them, but as he mentioned, it does increase medical errors. There is a relationship between it and also patient satisfaction. As you can see, there is, across the countries, a lot of, even in Kuwait, there is increased incidence of abuse against doctors. So when the patient is less satisfied, a lot of behaviors occur, such as they are verbally abusing the doctor or they are physically abusing him. Diagnosis of burnout is a bit difficult. First of all, maybe the doctor won't admit it to himself. Unfortunately, there is no golden standard tools to diagnose. There are some questionnaires and surveys, but there is not much really. But you can always go and talk to your family doctor or psychologist or psychiatrist about it, and maybe you can recognize it early on. Is there a link to physical symptoms? Well, from what we described, there is, but there is no hard evidence towards that. And the best approach is to take a good history, rule out other causes from the beginning. Let's go to the management of burnout. I think you'll enjoy this the most in today's webinar, especially my presentation. I think you'll enjoy that. So management of burnout is about the balance between work and life. And when work is more than life, here, if you're out of balance, you'll feel, burnt out. So it is really important to keep the balance in our lives, not to be preoccupied with work. Do not bring your work with you to home. Balance is key. The management is a multifactorial approach where we, in my clinic, for example, I try as much as possible, if anybody approaches me for this problem, to first of all rule out other causes and then move on with some lifestyle changes, behavioral changes, psychiatric. Of course, this is important to assess patients for any depression or anxiety. Then we have the environment at work and relaxation and mindfulness, which is my favorite part. Here, it's all easier said than done. And it isn't even easy to say. This is what a burnt out patient or doctor would say. It isn't easy. But trust me, if you do, start something, it will get easier with time. It becomes easier with practice. So I'm not going to go through all of the lifestyle changes, just a simple 4 points here. And because I'm talking to healthcare professionals today, I think this is where we, you know all about it. I don't need to go through it. Just a healthy diet, exercise, sleep hygiene, and prevention of disease. You know, you're healthcare professionals, you don't need to know much about that. You already know. But in the behavioral change, I think we do need some skills. Some can add lifestyle changes, but for others, it's a challenge. Lifestyle changes can happen naturally if you are used to it, or if you have this mindset of a doer, you know, I want to do this tomorrow, I'll keep doing it, then it is your mindset is already set for lifestyle change. But for others, it's really a challenge to incorporate like healthy diet or, you know, exercise. So maybe you will benefit from some behavioral change skills through cognitive behavioral therapy or dialectal behavioral therapy. Of course, dialectal behavioral therapy is part of, it is like one side, you know, it's like a CBT is the umbrella, and DBT is part of that umbrella. And dialectal behavioral therapy is often used for excessive eating or binge eating. It's used for depression, for suicide attempts. It's good for also dependency on drugs and smoking. So DBT has a lot of, it's more of, there is a CBT component in it, but it's very interesting to learn about. So first we will start with exercises and behavioral change. And we can create goals and have thought inspection. I'll go through the step model and emotional regulation. Then I'll go to the distress tolerance and crisis survival skills. Now, to create goals, we need to be smart, right? Specific, measurable, attainable, realistic, timely. How about you guys give me some SMART goals about some lifestyle changes you would like to incorporate in your daily life? So if you can give us some thoughts about the SMART goals, you can write, each of you can write one SMART goal. I'll just keep this slide for a while. Okay, so let's hear it. Tell me, I want you to write a SMART goal, not just the word exercise or meditation. So maybe you can write something like, I'll just go back here, something specific. So you would like to do some meditation. Measurable, you just say that I would like to do it, meditation every day. And you have to make it attainable and realistic. Of course, meditation is attainable and it is realistic. Timely, you just say, you know, I will do it 5 times a week. Well, reduce weight by 10% is a good one. It's very specific, doctor. Yes, and find some time for my hobbies. Ali, yes, this is really good. And we have Dr. Sanjay. He wants to go for 12,000 steps daily. Wow, that's a lot of steps, Dr. Sanjay, but I think you can do it. So I like the goals that you have added here. I think it's very inspiring. Let's go to the Fitz model. I don't know if you heard about the Fitz model. It is more about how to build the you know, priority. And I think what's going on with a lot of doctors is that they do not say no to extra errands or extra work. And this is actually used by the Navy SEALs. The Fitz model helps you you know, put your mission and make sure that it fits with your goals. If it doesn't fit with your goal, then you should just avoid it. So the Fitz model, just ask yourself, does this goal fit me? Does it fit with my life? Is it important? Does it have meaning to me? Do I have time for it? And is it simple or not? So I think the Fitz model is a really good exercise for everybody. Once you have a new mission, before you start it, just make sure it fits your life. Let's talk about your thoughts as well. So thoughts are interestingly connected with your emotions, and the emotions connected with your behavior, and then the behavior causes more thoughts, and etc. Thoughts can be the enemy. And I think it's a great idea for you guys to watch your thoughts. A lot of us have this dangerous thoughts that's been going on, so watch out for them. The first one is the all or nothing thinking. And it means that, you know, it's either I'm all in or I'm a complete failure. The second thought is the mental filter, where you only see your failures. Then the third thought that is very, you know, crushing, it is actually jumping to conclusions when you start reading minds and making assumption, and you start fortune telling. And it's, you know, who does fortune telling? I do sometimes, I do admit. And if you do, I think it's something that you have to consider avoiding. Emotional reasoning, you know, for example, I feel unaccomplished, so I must be lazy. So this is something that you make a reason for, or maybe you label yourself and say, you know, I'm a loser. Sometimes people overgeneralize everything, so they think that everything is awful. And people, despite that the positives are more than the negatives, they say that, you know, I think they don't even see the positive, they just exclude it completely. Some of us, with their thoughts, they make everything a catastrophe. And some of us think about the shoulds. So it should be, or it must be this way. Otherwise, you know, this is very exhausting. For example, what happened during the pandemic, there was for, I think, the ministry doctors, they wanted to offer them, you know, some money for their services during the pandemic, and it's a grant. So there was some delays in the grant. So what happened to a lot of doctors in social media, they were complaining. So they say, we should receive this. It must be this way. That's why it's frustrating. So they related the thought of that they should receive this grant to their work. So if they didn't receive it, they shouldn't be working as well as they should. I hope this makes sense to you guys. If you do have any questions, do write them in the chat box and I'll answer you. And lastly here, one of the, you know, thoughts, I think, is personalizations, is that they are taking responsibility for something. It's not their fault. And I do this a lot. I do admit that. I do take responsibility for something is not my fault. Even I blame myself sometimes for the weather. I think it's something when you are feeling a bit burnt out, even the weather gives you like, oh, even the weather is bad today. It must be my fault. It must be my bad luck. So remove this thought from yourself. And if you do have any thoughts that it doesn't have to be your own thoughts, but if you do have examples of, you know, terrible thoughts to watch out for, please do write it in the chat box. Moving on to the step model of emotions, where, they recognize that thoughts are automatic. So if you are in the same situation every time, the same thought comes in, the same emotion comes in, and it is like a deja vu, you can say, of emotions. So when you are put in the same situation again, the same emotion will come back. And this is often what happens with post-traumatic patients, where a sound or a visual, something visual happens, it just brings them back to the moment. Here, if your thoughts is positive, you can feel happy, joyful, and content. But if your thoughts is negative, you will feel the complete opposite. Let's think of a situation and how will it make us feel? Okay, I'll give you this example. You are driving and you have a clinic in 20 minutes. It is a 10-minute drive. Suddenly, there is a car accident. Now, what is the first thought that comes to your mind? Please share it in the chat box. If this ever happened to you on the road, what is the first thought that comes to your mind if you see a car accident and you will be very late for your clinic? I'm waiting for some answers. Okay, Dr. Hani said, it's okay, I will ask for an excuse. I like that your thought is positive, actually. So the second thought is, I think it's an action. So both of you are talking about actions. I think what we need is about your thought. Do you think that this is a terrible situation? Do you think that, oh no, I will be late for work? Or do you think, oh, it's okay, my boss will understand? So so all of you have written actions, and I'm glad that you think or you feel that there is support from your boss, from your friends and your manager. So it's a good thing. So I think if any of you thought, oh, that's terrible, I'll be late for my work, my patients are waiting, and there must be complaints. This is like a thought of a prediction, like she's predicting the future. And I'm sure that when anybody feels this way, they will feel automatically frustrated or sad or angry with the situation, maybe some road rage. And then the action will be maybe something like related to the attitude. Maybe it's related to, they will let it all out on someone, or when they go to work, they will feel really bad. They don't want to say hi to anyone. They just want to go to the clinic as quick as possible. So Dr. Raivaram said, any accident is terrible. I will be worried, but not stressed for something not in my hands. Beautiful, doctor. I think this is a great way of thinking. It shows me that you're not burnt out, which is amazing. Unwanted emotions, as I mentioned, can be a lot of emotions, even jealousy, embarrassment, greed, and annoyance is all emotions that we have to validate eventually and make sure that we don't feel annoyed easily or feel guilty. I think this is something that we need to avoid to have a happy life. But you know, life is not simple. There is ups and downs, and you have to be feeling those feelings, but do not let those feelings take over your life. If it takes over your life, it will have symptoms of burnout starting with you. A lot of things that we can do is to help people regulate their emotions and to understand and name the emotions. decrease the frequency of unwanted emotions, decrease emotional vulnerability, and also decrease emotional suffering through emotional regulation. And when you figure out how to change unwanted emotion, trust me, you will feel immediately better. So just make it your practice to identify and name your emotion. Ask your mind, is this a good emotion? Can I change this emotion to something more positive, like you all guys did in the situation that I mentioned? And act opposite of the negative emotion, because if you do react and you react badly, like if it goes to the extreme level of shouting, verbal abuse, I think this technique really helps you. In the stress tolerance, it is the ability to survive crisis. So you have to accept life as it is. You are the captain and life is your ocean, and you need to be ready, but not too ready. Take each day for at a time, because if you think too much about the future and what will happen, you'll really burn yourself down. So I think take each day at a time and accept this stress when it happens. And you can monitor your stress levels. So you can just say, if you are having high stress zone of 10, then I think some mindfulness and some relaxation techniques can help you. So make it a habit to monitor your stress levels every day. How stressed are you? Yeah, live in the moment. So how stressed are you at the moment? I hope you're not very stressed out from this workshop. No? Okay. I think silence means happy audience. Crisis survival skills. Now, if there is any crisis that happens, just, stop and take a step back, observe, and proceed mindfully. Because if you, get overboard and react with crying or extreme emotions, this can be detrimental to your mental health. So maybe it's a good skill to do. If you have a crisis, just stop first, take a step back, observe the situation, and then proceed mindfully. Well, I would like to start this PMR session with you guys, and I think you will be really happy about it. So I'll just open it for the first few minutes, and then I'll just shut it down, and I will ask you, how do you feel? So it's a great idea to just, write for me if you are feeling a bit stressed right now. So if you give me a scale from 1 to 10 and write how stressed you are at this moment. Okay, not too much, that's good. I think it's not working. Maybe I'll send it to you guys later. But I'll just start with you something instead of working this video. So I need you to close your eyes. Of course, if you're not driving, do not do this when you are driving, cycling, or on the move. I hope everybody's sitting down for this workshop. So let's start with closing your eyes. I need you to take a deep breath in, hold it in for a few seconds, and then take a deep breath out. Do it again and take a deep breath in, hold it in for a few seconds, and breathe out. Okay, now I want everybody to wrinkle their forehead as tight as you can. Wrinkle your forehead and feel the tension in your forehead. Now relax. How did this make you feel? Did it make you more relaxed? Do you feel like It's soothing. Progressive muscle relaxation feels this way. So whenever you feel stressed from work, try progressive muscle relaxation. It will really help you. There is also another techniques where you can soothe yourself and remove burnout is with Wise Mind Accepts. So you can do activities like movies, sports, volunteer. You can compare yourself to the less fortunate. You can listen to emotional music. You can, leave the situation mentally and deny it for a while until you're ready. You can sing song lyrics, read the Quran, and you can have some different sensations which is calming. Like you can hold an ice cube in your hand, you can take a hot shower, squeeze a rubber ball. All of those techniques can help you accept the situation that is stressful. Have you used any of those techniques? If you did, please share it in the chat box so that we have a look. Oh, that's beautiful. Everybody was relaxed with the forehead tensioning exercise. That's really good. Now, let's go to this image, guys. What do you think of this image? Does this image make you feel, uneasy? Does it make you feel annoyed, stressed? Ali said he feels stressed from this. Okay. Who else? Insecure. Nadine. Yes, you can feel insecure from this picture. What else? What does this image make you feel? Well, it makes me feel definitely unrelaxed. I like that Dr. Hani sees the beauty in this. Okay, so, okay, I like the taking action, Dr. Rayavaram, as usual. What about this one? What does this picture make you feel? So, oh, happy. Okay, good. It makes you happy. So it's really easy to trick the mind. So sometimes if you're stressed and you feel like you are really stressed out, do look at something beautiful. Sometimes just looking at images and what I do sometimes is I do some sound walks where I close my eyes when I'm outside, when I'm, of course, safe and away from the road, and I start listening to the sounds around me from the background. And it is something that is a beautiful thing when your mind doesn't think about anything else but the simple beauties of life. Even if we don't have this amazing view, just look at the picture. It immediately makes you feel happy. Don't forget, if you do feel burnt out, we must recognize depression and any psychiatric problems. You can always go with the screening questionnaires, like in patient.info. And I'm sure all doctors know how to spot anxiety and depression if it's there. You can change the environment at work or at home. So maybe you can use some housekeeping techniques. Do you know what housekeeping is, guys? You can tell me, you can write down what type housekeeping means. It doesn't mean cleaning. You can talk to your superior about it. You can inform KMA for legal support. You can write an OVR. You have to maintain a healthy social relationships. If you do have a problem with your spouse, you can go to couples therapy. You must prioritize the relationship and spend quality time with people that matter. You must be relaxed and mindful. So mindfulness, like a body scan and sound walks and progressive muscle relaxation, yoga, massage, and doing your hobbies is, I think it's important. What is your hobbies? Do you have any hobbies? Yes? Cooking, okay, one of the hobbies out there, okay. Everybody loves cooking. Food is delicious. You can always do box or square breathing when you're stressed out. I really recommend that you try this out. And we can do it together if you'd like. So I think we did it in the previous one where you took a deep breath in and you held it for a few seconds and took a deep breath out. This is how you do square breathing. So as I mentioned, so you have suggestions. You have clay crafting, beautiful Aisha. Dr. Hani loves fishing. Dr. Ankit likes gardening. Nadine likes writing. And I think it's a beautiful thing when you practice your hobbies. Please do practice them and have time for them. My advice is do more of the pleasant and cherish all your happy moments and stay true to your values, the honesty, the integrity, sincerity. Just stay true to yourself. I do recommend those apps for you guys, Fabulous app and Learn to Live website for more techniques on how to manage burnout. And that's it, really. Thank you everybody for listening to my presentation or my workshop. And I would like for everyone to fill in this form. And I'll send it to the chat box. Dr. Mohammed, do you think my presentation, you found it useful? Do you like the techniques that I've suggested?
Yeah, definitely. I found very, very interesting. I didn't know most of these, and it was very thorough and it was very nice.
I think with a lot of practice and I'm foreseeing the future here, but inshallah, there will be support groups with the KMA to be offered for doctors and healthcare professionals where we all gather and talk about the things that you are worried about. But let's ask, since Dr. Mohammed is here, I would like to hear some legal questions from you guys. So if you do have any legal questions from you guys to Dr. Mohammed, please do ask. I'll start with my question until we see more from our viewers right now. So Dr. Mohammed, there is something about the way reporting to KMA if there is any burnout. So what number to reach out to, or what is the email that they can reach out to?
We have several domains if anyone would like to reach us. Of course, the headquarters of KMA is in Jabriya. We have our site, kma.org.org. We have our own application. You can find it in the App Store or Google Play Store. We have also our Instagram account and the Twitter account, all working. You can reach us there anytime, any questions, anything you want. We will be more than happy to help you, to guide you. It's our pleasure and it's our work also.
Oh, that's great, Doctor. We do have a question here for you. There is a question, self-reporting. Is it allowed for the physician? If you can specify, Doctor, about this. Yeah, what do you mean by self-reporting? I think maybe reporting an incident like abuse. Let's assume that until I have an answer.
Definitely, yeah, definitely. We will provide, we have a legal office. Available in KMA. It has its own office. He can go there. He can write whatever he likes, whatever report he gets let's say, verbal or physical abuse, he can report it. We also provide a full lawyer, legal services. It's fully paid for all doctors. Depends on the case, also, of course. If you have a case inside a hospital, it's fully paid. It's outside the hospital, it's 50% will be paid. So yeah, he can report it.
Good. I think he's saying here, meaning he feels self-burnt out. Can he report his own case?
Definitely,
This is what he means. Yes.
He can report to us. We have a secretary for those kinds of things. We collect the reports, and we have regular meetings with the leadership and the minister himself, in which we present these types of things, and we can find a solution if available or not. We can do seminars like the one we are doing now, and other seminars can be in the future also to help these things.
Great. Now, Dr. Mohammed, another question before we end this session. So there is something that we don't understand about the burnout that we have in Kuwait among healthcare professionals. Is there any future of studying this phenomena from KMA, or do you have any ideas of how to manage this problem in the community?
Burnout in doctors, of course, we have a plan, a cooperation with you, of course, since you are the one who has the initiative and initiate this problem and highlighted, which is very important. And I sincerely thank you for that. Definitely, we are working. We have plan in the future to do a group support. We will provide a hall, the KMA, for these types of things. We will provide also psychiatric help if needed. Also, we'll collect the reports, as I have said before, and to see the core problem is and how to do it. Regular seminars, I think, is very important to highlight. Burnout will not be shown in a single way. Different types of symptoms, different types of behavior can be seen. We are still learning, especially in the pandemic. We have seen this a lot. And myself, I even did not imagine that this number is there. It is a big problem, and definitely it's the doctor's right to ask us to solve it, and we will, inshallah, have a good plan in the future.
Great. I think this is very promising, Dr. Mohammed, and I thank you so much for being here in the workshop. And we will looking forward to working with KMA and reaching the goal of reducing burnout as a phenomena in Kuwait. And thank you, everybody. Dr. Mohammed, can you give us just final tips from you before we leave?
Final words. I really like to thank you. You are the pioneer in this subject. You have started this from the very first beginning of the pandemic with us. We did some seminars. It was very helpful. We have a great feedbacks about them. People are asking for more. Definitely, we are here. We are willing and happy to help you all, whatever problem you are facing. We are the representative for you guys. Whenever you have a problem at any kind, it does not have to be a burnout. You have a problem, say legally, you have a problem in your work. This is your home, this is your house, we are your colleagues, we are your brothers and sisters. More than happy to help you. And we are here whenever you want us, and you know how to reach us.
Great, great. Well, there are a few questions here that are interesting. So one of them is, why are doctors in the private sectors not considered frontliners? The second question was, why private doctors must obtain a release letter before moving to another hospital or leave Kuwait for 1 year? It's very interesting questions.
It's administrative questions. So let's start.
It is.
Why doctors in the private sector are not considered frontliners? It was the frontliners was defined, and the award was also been defined in a law that was said by the late Amir Sheikh Sabah Al-Ahmed, and he specified this for the governmental hospital workers. That's why. The second question, why private doctor must obtain a release letter before? Yeah, it's a civil employee law. You have to get at least 1 year for several reasons. One of them to have like a clear picture of the career you have been in, any problem that might rise during this leave. You know, our cycles in the documentation in the country is slow. We're still doing papers. I think in the coming days we are working to make this thing to be electronic. It will not be 1 year. It will be much less. And the letters will not, you don't have to go through each office to get a certain letter and to get a specific signature. This will be easy. We have been in a committee in the ministry in which everything is going to be electronic, private, public sector, all of them together, and the things will be much easier in the future.
That's amazing. I think this is promising as well. Thank you, Dr. Mohammed, for being here. I really hope you have a lovely evening. And thanks everybody for being part of this workshop. ضمان employees, make sure you answer the form. If you answer the form, you will enter a prize draw, a really nice prize from the PR department, and have a lovely night. Goodbye, everyone. Goodbye, Dr. Mohammed.